Right. This is the second exercise that we are doing in the series to decrease patellofemoral pain. By strengthening the hip abductors, extensors, and lateral rotators, these muscles combined with the education on this proper lower limb alignment during this weight-bearing exercise will decrease patellofemoral pain. So this is a ball wall squat, and Desiree will instruct.
So the patient is going to be standing upright, and you can see there's a therapy ball behind the patient and then against the wall. The feet are shoulder width apart, and she's slightly leaning backwards so that when the patient goes down into the squat, the knees aren't going to go over the feet. And so the first one is going to be without the weights, and I'm just going to have your patient go down into a squat. And they're going from that 0 degrees to 60 degrees of knee flexion, and they're going to be holding that isometrically for 5 seconds. And then you can progress the patient to have them hold that for 10 seconds. And then as you're progressing the patient, you can begin to introduce weight. Now normally you'd have 2 dumbbells, 1 in each hand, but we have 1 here for demonstration purposes. But patient's going down into that 60 degrees knee flexion, holding it for 10 seconds, and then coming back up.
And in the acute phase, you would, in that first phase, in the first week or 2, you can do 2 sets of 20 repetitions with 5-second isometric contraction, like Desiree said, and progressing to a 2-second hold. And then by the time you get to 3 weeks, you can progress to a 10-second hold by doing 3 sets of 12 repetitions. Still holding with that isometric contraction. The initial load would be about 10% of body weight, so she could actually increase that weight to probably 10 pounds. And then she can increase each week by increasing that weight that she's holding by 5%. And then weeks 6 and 8, you continue to progress the same way, keeping those knees behind.